This is Urban Health Today, and I'm speaking with Dr. Amy McMichael, Professor of Dermatology and Visible Steering Committee member. She's here to discuss new findings from Johnson & Johnson's Visible study, a first of its kind 100% dedicated to diverse patients, and what this means for patients of color. Thank you for speaking with me today, Dr. McMichael.
It's my pleasure. Nice to see you today.
It's a pleasure to have you. All right, let's get started. Please talk about your background and your work with Johnson & Johnson.
Oh, absolutely. So I am a professor of dermatology, as you stated, and that means I do academic work at the medical center, as well as see patients and teach. So I try to carry through the tripartite mission of academic medicine, which is research, teaching, and patient care. And I've always been interested in patients with skin of color. One of my particular interests was or has been the interest in patients with skin of color who have psoriasis. I was trained at University of Michigan, where psoriasis was the end all be all. We did a lot of psoriasis work there. That was over 30 years ago now. But while there, I really got an appreciation for how severely psoriasis really affected particularly patients of African descent, much thicker plaques, significant coverage, difficulty really, getting them to clear. So it's always been on my mind, how we can really address this, how we can look at these data, how we can understand patients of color with psoriasis, and how we can make sure that they're getting the best care.
Can you give a high-level overview of the Visible study? Why is it
Yeah, oh,
important?
absolutely. Yeah, the visible study in my work with Johnson & Johnson has been really groundbreaking. I mean, it's so exciting. This was really a brainchild of some of the leadership in the company, and they sought leadership from, they sought out leaders who are leaders in the field in skin of color and dermatology, psoriasis in skin of color patients, and people who really know how to run clinical trials. And they asked the questions. They said, if we were to run a study to look at patients with skin of color, what do we need to have? So right from the very beginning, they got input from people who really knew what was going on, and unusual as it seems, the company actually took our recommendations, which was to look out for people who actually see patients with skin of color. A lot of times when people do clinical trials, and this is across medicine, they go to certain centers that they know that they can depend on to recruit very quickly and get people into the trials so that they can, kind of move along, because trials are very long, expensive, and it takes a lot of time and energy to run them. But
Right.
in this case, they took the information and the recommendation to go to where the skin of color patients were, even if the people seeing those patients weren't uh, typical clinical trialists. So they took people who were, in the communities where patients with skin of color with psoriasis were. They trained uh, those dermatologists who were seeing these patients to be clinical trialists, hooked them up with seasoned people who do trials all the time to make sure that they could understand what they needed to do and to do it appropriately. And what was so amazing was that they actually even took the time to make sure that they had the information about the trial that they were offering to patients translated into different languages so that people would feel very comfortable speaking in their primary language. They made sure that patients who needed to come back and forth for trial visits had drivers and money to do that as part of the trial. And they just made sure that all the things that usually prevent people with skin of color from participating in trials
Mhm.
were covered. I mean, we went over all that in our high level discussions, and then they went down and made sure the details were completed, which was really amazing. So that meant that everything was in place for it to be a success, but nobody expected how much of a success it really was. And what I mean by that is that the trial recruited in record time. And so this was like faster than any of their other psoriasis trials that ever recruited, which is kind of outrageous, right? Because they usually go to these people who really know what they're doing and can really recruit quickly. And the data that was coming in was, really top notch, including now a huge library of photos of patients with, really all Fitzpatrick skin types, but really focused on Fitzpatrick skin types 3 through 6, which are, the darker skin types, where we can actually look and learn about psoriasis, how it progresses during treatment, what happens after treatment in terms of post-inflammatory hyperpigmentation, which is a huge problem for people with skin of color after any inflammatory process. So we have that library of data now that we can mine probably for years. We have data outcomes which showed that all the people in the trial, both of which, they were sort of patients who had really mostly skin on the body psoriasis, and then a group that had primarily scalp psoriasis. Both groups did great compared to placebo, just, what we would have expected with the Tremfya drug, with guselkumab as a drug in other trials. It worked equally as well in this group of patients, both those with psoriasis in the scalp and both those with psoriasis in the body. So really amazing outcomes to show us that yes, we assumed these drugs work in patients with skin of color, but we didn't have that documentation. Now we know. And then we also have these lasting, photographs to learn from. We have so many other data points as well. Did people who have, high blood pressure do differently? Do people who have high cholesterol do differently? I mean, all of these things are part of now a database that is going to be looked at so that we can understand how patients with skin of color are going to respond, in terms of getting better on their psoriasis.
How did you find the providers so quickly?
Well,
Because
we
a
know
lot of
who they
providers,
are.
oh, okay. Yeah,
Yeah,
because a
so
lot of
so
providers
it's
express concern about not
yeah,
knowing enough about studies to involve their patients in it. So that is
yeah,
remarkable that you guys were able to pull that off so quickly.
yeah. There are a number of people of color, primarily dermatologists of color who have an interest in doing studies. They typically weren't looked at as options for studies because they
Mm.
weren't learned, clinical trialists. And so now this has actually made them experienced. So hopefully going forward, other groups will tap them as trial sites. So I think this was one of those things where, we had the all the pieces, they just weren't all put together very well in the past. And so I think Johnson and Johnson was really committed to putting all the pieces together.
Can you talk about why focusing exclusively on diverse patients with psoriasis is crucial?
Oh, absolutely. So I kind of intimated before that, many of us have noted in our practice that patients with psoriasis or skin of color have significant problems that are different from people who are Caucasian. And one of those is that post-inflammatory hyperpigmentation that I talked about. So as people are clearing, they have this. And we want to know, how long does it take for patients who have psoriasis and clear? How long does it take for that pigment to go away? Because that's still a disturbing part of the disease process. We also note that these patients have very thick, plaques that are, extremely scaly and almost hypertrophic, which means that they're sort of raised much higher than a typical psoriasis plaque. And we wanted to know, can these patients actually respond to typical treatment and respond in the time frame that is, typically allotted for a clinical trial. So I think that for those reasons, the extensive disease, the thickness of the lesions, the uh, post-traumatic, post-inflammatory changes that happen in the skin. None of that was really understood. And so I think it was really important to start to focus on, okay, so what's happening? Do these people get better? What happens to the lesions? What happens after the lesions are gone? And that's what this trial has been able to help answer.
And what are the most significant findings from the visible study?
Well, I think I'm, sort of, let the cat out of the bag. Some of the most significant findings are that the patients actually did quite well compared to placebo, whether they had scalp psoriasis or body psoriasis or both. The other thing is that patients actually didn't have, any side effects or complications that weren't expected, in a typical clinical trial, upper respiratory tract infections, et cetera. So I think that we really proved, with this trial that we can do trials like this. That was one of the biggest, kind of outcomes, is that there's no reason not to have patients with skin of color in every trial where patients with skin of color have that given disease. It's been something that the NIH has recommended to do for every clinical trial that comes through, but it just doesn't happen. So I think that one of the biggest takeaways is that this can be done, and it can be done in record time. People always think about, well, we can't do this because it's going to take a lot longer. We're never going to get our results. That's not the case. And so I think that's a huge takeaway.
So you talked about the thicker plaques almost being hypertrophic in some patients. Please
Hmm.
talk about patient-reported quality of life outcomes, particularly
Yes.
concerning the post-inflammatory.
Right. In terms of quality of life through the trial, for the actual trial itself, regarding um, how patients were feeling, as they were getting better. I think we've got that data. I don't have the specific numbers today. We can provide those to you. But what we do see is that patients were very, very improved. Their quality of life improved significantly while on this medication, both for scalp and for body psoriasis, as they improved compared to placebo. So I think that was, pretty good outcome.
How does psoriasis present? Well, you talked about how it
Hmm.
presents differently on darker skin. And how does the visible study address this issue?
Well, I think that the photos are really where the money shots are, right? We have photos of the scalp, which are, to be honest, quite difficult to get because there's hair on most people's heads, and so
Mhm.
when you're photographing the scalp, it's difficult to see. But what you can see pretty clearly in these photographs is that you can see where psoriasis typically comes down onto the forehead, it comes around the ears, it comes around the neck. And so when people are presenting themselves, they have to figure out how to cover all those areas. Well, this study was able to show, consistent improvement, kind of along the different stages of the trial, following those scalp lesions. Also on the body, they did have focus lesions, obviously, that they focused on, how did this one lesion do? But there were body shots, looking at, sort of everywhere that there was psoriasis. And this, I mean, it's just never happened. It's just never happened before that we have all those views of people with skin of color. And we also have what we call PASI data. So this is the psoriasis, area severity index, where, you're looking at a lesion and you're seeing, okay, how thick is it? How scaly is it? How red is it? And all of those things were documented for these patients. Now, in previous trials, because patients of color don't always have redness, with their
Right.
lesions, a lot of times they weren't allowed to be in the trials. So again, the PASI scoring, was able to help, you know, show how would you use PASI scoring in, skin of color trials. How do you use it so that you don't omit, one whole segment of the population by not seeing people's skin of color because they're not red enough? And I think that, setting those limits and an appropriate limit, but still being able to use it, was very helpful, and I think will be very helpful going forward in the next trials, for any other medication for any other company. I think this is the wave of the future, and I think this Johnson and Johnson has shown people how to do the work.
So how will the photos be made available to HCPs? What medium will they be? Will they be posters, the book? What
I
medium?
think there's going to be a number of different ways. So right now, posters are being submitted to significant number of meetings that are coming up. So the fall clinical dermatology meeting, the winter clinical dermatology meeting. So large scale meetings where, people are in great attendance. One of the biggest meetings that we have in the world in dermatology is the American Academy of Dermatology meeting, and there will be numerous posters, available there. But and that's great. Podium speakers will be able to speak on them, that sort of thing. But I think even more, I think there's going to be a downloadable website that Johnson and Johnson will make available to researchers and dermatologists, folks like you who want to understand, what's happened in the trial. So I think there are going to be a number of modalities that are going to be used. At some point there may be an actual, published data, because we want to make sure that it's not just out in the ether, but actually in the journals. And so we're going to have, published data on those too. So I think it's going to be pretty much anything that makes sense academically, you name it, it's going to be done.
That'll be good for primary care providers particularly, I think, to get their
Hmm.
hands on that so that that'll expedite diagnosis. Um, what are the common challenges that people of color face in receiving proper diagnosis and treatment for psoriasis?
Well, I think access to care is, a huge one. We've already documented as dermatologists, most of us are in areas that are primarily Caucasian. If you look at data from, several studies, you can see that the majority of neighborhoods where there are primarily underrepresented minorities in this country, there aren't any dermatologists. And so I think that's one of the big issues. So getting to the actual dermatologist is problematic. Excuse me. And I think the other thing is that if they do go to their primary doctor, you're right. People don't know exactly what they have because sometimes it doesn't look exactly like what people think psoriasis should look like in the textbook. So they get treated or undertreated, I should say, or mistreated for a long time before they actually make it to the dermatologist, even if they make it to their own doctor. And then finally, I think misdiagnosis does occur. I think patients sometimes are looked at as if they have eczema because, again, the redness is not there, or perhaps that they have something called lichen simplex chronicus, which is where skin gets thickened over time and gets very itchy, but is a whole different process than psoriasis and is treated differently than psoriasis. So I think that those are some of the biggies. And if we can get patients, number one, evaluated, get them into the dermatologist, and also people can start to recognize what changes, you see in skin of color for psoriasis, um, and then get them on the right treatment. That's, I think, where we can overcome those big obstacles.
In what ways would you say visible study affected patients who are underrepresented in dermatology?
Well, I think, if you look at the cuts of people in the study, there were significant numbers of people of Hispanic ethnicity, probably about 11% of Black patients, and a numerous number of Asian patients. One study uh, a few years ago documented that when compared with patients of different ethnicities, different races, Asian patients probably had the least amount of time spent with them in psoriasis visits. And
Oh,
that's really pretty sad. So I think that, what this study is going to do, is going to highlight, the numbers of patients of different races and ethnicities who actually have, really severe disease and require extra time to be educated about their disease. Because if you don't educate patients, they don't even understand what medications they should be taking. Perhaps they have concerns about taking systemic medications. Perhaps they have concerns about taking injectable medications. These are all reasonable concerns that any patient may have, but particularly underrepresented minorities who don't get enough time to even talk to their doctor. So I think that hopefully this trial will start to open the doors for patients to actually feel, like they deserve to be treated, and also for providers to start to recognize what they need to do differently to treat these patients.
what steps do you think can be taken to educate healthcare providers about recognizing and treating psoriasis in diverse populations?
I think just what we talked about, I think getting the data out there on podium talks, posters, publications. I think that, most dermatologists are very academic. Even if they're in private practice, they still like to keep up with the latest. They want to know what's going on in their specialty. And so I think if we make that data available to them in whatever fashion that they like to hear it, some people like to go to meetings, some people like to hear it in CMEs that they can do at home. Some people like to see it in an article. If we make it available to them and all the forms that people like to learn and like to get their continuing medical education, I think that's going to be, helpful for everybody to sort of just get the message. I also think that, we need to put the message um, in dermatology residencies because the residents are the next generation of dermatologists. So as they're training, they need to hear it. And I think that we can do that with, appropriately timed talks to resident groups when they come to either meetings or really come to them wherever they are in their residency. So I think getting those trainees, really set up for understanding what they need to do in the future is going to be key as well.
That's interesting that you said that because I spoke to someone several weeks ago, and he talked about the hesitancy among residents
Mhm.
and derm students, hesitancy in embracing different, like biologics and stuff like that because they don't want to be seen as being owned by the pharmaceutical companies. Can you talk about that a little teeny bit?
Yeah, so I think that there are many residencies who have a closed door policy when it comes to pharmaceutical companies. So they don't like their residents to talk to representatives from pharmaceutical companies. They're concerned that maybe their practice would be stilted because maybe one pharmaceutical company has more advantage than another to provide something for that resident. And I think it's a reasonable concern. I think that yes, you have to make sure that residents have a balanced view of what's out there, but you also have to give the residents the view of what's out there. So if you're so closed that you can't get them the latest information about psoriasis and how to treat psoriasis and psoriasis and skin of color, particularly in residencies where maybe they don't see patients with skin of color, then you're going to do them a disservice. What I always tell people when they talk to me about this topic, that they don't find to be as maybe important as maybe other topics, say skin cancer or some other topics in dermatology. I say, as a Black dermatologist, I don't tell my patients who are Caucasian, you know what, I'm Black. You can go somewhere else for your skin cancer. I don't understand that.
Right.
It's part of our training. And this should be part of our training. If you are going to be a dermatologist, you need to understand psoriasis and you need to understand it in every skin type, not just the ones that have classically been in the textbooks. So I think it's all part of exposing our residents to the knowledge base that they really need. So I don't think it's about really the company. I think it's about the data. And that's why, we put it in a peer-reviewed literature, because if it's peer-reviewed, the bias is taken out, it's data and it's something that they have to learn. And that's where it's going to end up going. And that's where they're going to read those papers and hopefully get the information. Yeah, maybe they won't have a lunch or dinner, and that's fine, but they need to get to that data somehow.
Very well said. Dr. Amy McMichael, thank you so much for your work and for bringing the focus on skin of color with plaque and scalp psoriasis. Really,
Oh,
thank you.
thank you so much. It's been my pleasure.